Hi, and welcome to the Health for Life podcast for those who want to build strong trucks and strong bodies. This is Kevin Muniz and Trisha Foley, your wellness team, bringing you practical tips and tricks to improve your health.
Hey, everybody. Thanks for listening in. We are so excited to have another guest today, our very own Dr. Hanks, who is one of our awesome providers at the Volvo Family Health Center.
And thank you so much for joining us, and we are super excited to have you here today. And since it's National Men's Health Month, Dr. Hanks is going to be sharing some really good information on what men need to do to stay on top of their health.
Yes, and if you're a woman like me, don't tune out. This is some great information that you can definitely share with that special man in your life.
Yep. Hi, everybody in Radio Land or wherever we are.
Excellent. So we are excited to have you here today. So men don't always think about prevention when it comes to their health, especially when they're young. What are some of the main screenings that men should be taking a part of at any age?
Yeah, you're totally right. Women more usually come in and they get their yearly exams, maybe even have children sometimes. The guys just kind of disappear. And it's really a shame because they lose a lot of precious time and they can really come back to bite them. And it really costs them later. A lot of things I will mention is the U.S. Preventative Services Task Force. That's jargon, but they kind of determine what is worth screening and what's best to do. And one of the things that's recommended is doing a screen for coronary artery disease about age 20, and that includes getting a full lipid profile, cholesterol and such, and blood pressure, and just seeing what risk factors somebody has. If you don't have any risk factors, then it really kind of relaxes how often you need to come in. But if you do, then obviously we need to be following those things. They recommend checking blood pressure every year, although I will put this bit of information in. It's really good if you can do that out of the office, because I don't much care what your pressure is in the office if it's always normal everywhere else you are in your world. So you just check it in occasionally, put it in the machine at the store of your mom, your grandma, whoever. The other thing is if somebody is overweight, over the BMI, body mass index of 25, generally it's recommended to get at least one screen for the blood sugar and then kind of follow that along. And the thing I kind of look at with health maintenance is that it's a lot like, not everybody plays the lottery, but before you play, you ought to know what the risks and the rewards are. And life is like that. And we just kind of ignore those things until it's too late sometimes. That's rough. Particularly knowing your family history. If there's family history of heart disease or stroke, family history of cancers, those are things that we ought to know, and we'll work together to figure out how much risk you yourself are at.
Yeah, that's such great information. It sounds like there's some standard screenings, and then there's others that are really unique to you and your family history. And that's why it's so great to establish that relationship with you, Dr. Hanks, or somebody's family practitioner, so that you can really dive into that with the person. What are some other screens that should be done after, let's say, age 40?
Yeah, I mean, as life goes on, there's more wear and tear. So after 40 is probably where you start to pick up the action. Some of that is family history driven. If there's a family history of, for example, prostate cancer, then guys should be screened with a PSA in their 40s. And everybody gets one by the time they're 50. And not everybody, but every guy. We can talk about that more. You start to think about colonoscopy in families where there is colon cancer or family polyps or that type of a thing. Again, that's in the 40s. Again, if there's none of that, then 50s where that picks up. And the other thing we see a whole lot around here is of course, smoking and tobacco. And increasingly, that whole evaluation is evolving, because there's something called a low dose chest CT scan that is actually recommended for a yearly screening. If people have more than 35 pack years, it's got very low radiation, so it's not very risky. And the whole point is to catch a lung cancer before it becomes more of a problem, spreads and does other things. I mean, that's a cancer that's not any fun at all. So those are the things you would tend to add, in addition to just your yearly exam and looking at the main risk factors for coronary artery disease and just staying healthy.
So I heard a surprising statistic that 1 in 8 men would have prostate cancer diagnosis in their lifetime. What are some of the signs that it's time to go and get that checked out?
Yeah, that's another. Speaking of evolving, that's another point. Because truthfully, most commonly you don't have a lot of symptoms. I'll talk about some in a second, but most folks who are found to have a prostate nodule or cancer don't necessarily have symptoms from it. Again, if there's a family history of it, that puts you more on alert, and particularly in the case where there's family histories of folks having it at a younger age, because those tend to be more aggressive, and that is something that really will impact your life. We refer to the prostate symptoms as lower urinary tract symptoms, or LUTs, but it's basically if you're having trouble passing your water or trouble getting it all to come out, or you have to go back in 5 or 10 minutes and do it again, or if it's painful with urination, or trouble shutting it off when the waterworks is supposed to be done. Clearly, if you're seeing blood in the urine, most of us would come right in for that, but that's something to watch for as well. The thing about the PSA, that's the prostate-specific antigen. It's a blood test. Nobody was coming in. Let's be honest. I mean, I'm a guy, and I remember my first exam with my doctor for checking my prostate, which, if you don't know, is a rectal exam. And I wasn't excited about that. I'm a doctor. Guys weren't coming in for that. The PSA is a way to check a blood test and get a good read on that. If you got a steady baseline and you know what it is, it shouldn't hang you much over the years. But you got to know what you would do with the result. That's a test that you really only do by agreement with the patient. For one thing, it's really only a screen, unless there's a family risk, it's only a screen between 50 and 75. And I've heard it said that, if guys live long enough, they'll all develop some cancer or precancer in the prostate. And that's probably true. Most prostate cancers like that, just from age, are not going to threaten your life expectancy and are not going to change your life much. But the earlier ones or the more aggressive ones, those are the ones we really watch out for. So blood in the urine, trouble passing the water, or family risk. And that's what would really push us in that direction.
Wow. Yeah, no, that's great information, especially since it sounds like there aren't very many symptoms, or symptoms that you could kind of just pass off and not really pay attention to. So curious, other types of maybe preventative screenings recommended for specific lifestyle choices, like let's just say like my husband smoked or enjoyed a beer here and there. What would he need to consider for that?
Yeah. I mean, preachers used to say, now you've gone from preaching to meddling. Alcohol is an interesting subject because, particularly if you're a doctor or if you're working in an emergency room, you've kind of gotten used to at least doubling whatever anybody says they ever drink, because we all tend to underestimate that or just kind of sweep it under the rug. And there's a series of questions that we ask from an alcohol standpoint. And here's kind of the thing. A little alcohol is probably a good thing. A glass of wine can help with your lipids and your cardiac risk factors. And so nobody's saying, oh, you can never, ever have anything. But you got to be kind of clear-eyed about it. I mean, how often do you drink? I mean, how many drinks do you drink at a time? The big number you kind of do as a rule of thumb is if you have days where you're drinking more than 5 drinks a day, how often does that happen? If it happened, a few times a year, a few times a week, I mean, that really kind of escalates it. The other questions that we look at are things like, have you ever found you couldn't stop drinking once you started to, or were you unable to get something done that you promised somebody you would do because you've been drinking, or do you have to find yourself drinking in the morning to get started? I had a friend who used to say we went camping and he'd get up and make himself drinks in the morning and he'd say, "Good morning, liver," and he was kind of laughing, but I hate to say the man is not with us anymore. That's a little dark, but those are the kind of questions we ask. And another thing, and I will put this out there, is there a relative or a friend or anybody tell you that they were worried about how much you drank? Because if you got that, that's of a concern. Alcohol is one. Tobacco is probably the main thing. If I had to pick one thing for almost any of my patients that would improve their life and their health and their life expectancy, it would be tobacco cessation if they could stop it. But most people feel like they don't want to get nagged or fussed at. I will just say this, and you guys know this because this is what you do. It's proven that intervention, that having either nicotine replacement or something to help with the withdrawal, and having the support of a health coach works. It's well over twice as effective, and even if you fail one time, the studies say you can succeed the next time. So I put that out there, and not to preach, but just to make sure that you don't feel like, oh, there's nothing I can do about it.
Excellent. So in your experience, what do you most commonly see in your practice? Like, what should men be paying attention to as far as early warning signs?
Yeah, a few things. As far as commonly said, of course, we work at a truck plant, and people listening know how difficult that is. So I will just mention this. I mean, you think about the joint and back pains that we all have and that come on more over time, but certainly, doing hard work can be a factor there. And again, this kind of gets back particularly you to Kevin, but the stretching and strengthening can make a big difference with a joint, because you can't repair wear and tear in a joint necessarily. But if you strengthen the supporting muscles and structures, you don't have to have pain and inflammation with activity. Again, not to nag, but if carrying extra weight really increases the PSI on your lower extremities, on your legs and in the back, and weight loss can be a big factor there. I mean, people just need to understand, I think, from a back and joint standpoint, the things that we really kind of get our attention in those cases are if the joints are becoming unstable, where they don't want to hold you up or they're not working right. That needs further evaluation. And if back pain or neck pain is now going down your arm or your leg and giving you numbness, weakness, that's something we definitely, because that's something that may need further intervention than just the stuff I mentioned. As far as what we see commonly, it's interesting how common sleep apnea comes up. People used to think snoring was just really funny. Used to, if anybody was snoring, that was a big joke. And when you were kids, you thought it was funny and pretended to snore when you're sleeping. And actually, it's not terribly funny. If you're snoring, you're probably not moving air as well. If your spouse or partner or somebody has said, "Hey, I think you stopped breathing at night," that needs investigation likely, because if you're spending a third of your life asleep, ideally, and your oxygen levels are running low all night, you're running a race all night. That's not rest. That's more stress. And it can lead to a whole lot of conditions. And so I kind of mentioned that about the snoring and the idea whether you stop breathing at sleep. If you wake up in the morning and you don't feel like you've even slept, if it's not restorative, if those kind of things, those are signs and symptoms that say maybe looking, at a sleep study is a good idea. And they can do those at home as well as in hospitals now. So they make it a lot easier to do that. And I think I'd be remiss if we're talking about guys here. I'd be remiss if I didn't mention some things that are near and dear to guys, and maybe I'm being a sexist in reverse, but there's more than a few people that come in and eventually will confess they came in, they said it was for this, but they actually came because they're having a little erectile dysfunction, a little trouble in bed, or and that's not uncommon. I mean, there's a lot of factors that go into that. Probably shouldn't be as scary as it is to all of us, but there are definitely things to be done about that and to be evaluated. We do check serum testosterone. If the testosterone's low, that creates issues, and not just with the function, but with the drive. As far as the ED itself, I mean, it's very related to things that are related to cardiac disease too. So excess body weight, high blood pressure, certainly some medicines like some of the nerve medicines, some of the cardiac medicines and blood pressure medicines can have an effect. Many other medicines don't, and there's also some things that are pretty easy to treat. There, most cases respond to the things we can do here in the office. If there's really severe cases or difficult or situations that are unusual, we can refer this to a specialist. But in this day and age, they don't have to do a lot of weird things to you. I guess I would also mention the idea of whatever one's level of sexual activity is, but remembering that hepatitis and HIV are sexually transmitted diseases as well. And so if somebody has behaviors like that put them at risk, we can send off blood work that will at least help screen for those kind of things. I don't know. That's a little bit of a different track, but I think those are important. And again, if you're talking to guys, those are things they care about.
Right. No, I appreciate you opening that up and kind of addressing that stigma, because I do think it is an important piece to talk about, and something that can be maybe a little bit embarrassing
Yeah.
to discuss. So thank you. Good information. I'm also curious if you could share what you hear as to why men don't come in for appointments. I know you've covered that a little bit already, but are there any misconceptions that you could help clear up today?
There are several. And I mean, I've had a whole career of this. I'm from here originally, and I started back in medical practice in the area in '88. So I've been doing this for a while, and I've had a long time to think about that question. Um, and I think one of the main things is the idea that when you come in, that we here in the office want to nag you, and I want to remind that every guy, or every woman too out there, that I'm not your mama. I'm not judging you. I don't need to judge you. I'm not nagging you. I'm here to work alongside you and kind of help. If you have things that we need to steer through, a particular problem or just concerns you have. I mean, it's really not about that. So, don't worry about the nagging. The other thing about guys is, and all people are this way, but guys may be a little worse. Guys are really good at denial, just ignoring, oh, it can't be anything. It's not a heart attack. It's just some roast beef I ate or something. If I had said that, I wouldn't be here right now, because I had a little heart issue a couple of years ago, and fortunately, I didn't deny that, and we did take care of it. But guys can be an ostrich; they just stick their head down in the sand and not pay attention to it. Also, guys are supposed to be strong, or no sign of weakness, or I'm indestructible, or even I love this one. I'm a provider. I've got to take care of everybody else. The women will say that too, by the way. That's a 50-50. But what kills me about that is, if something happens to you, how are you going to take care of anybody else? So. The one question I would ask guys listening, and particularly here at Volvo, having looked at the parking lot and what people drive to work, how do you treat your truck? How do you treat your pickup? Do you take care of it? Do you keep it moving smooth? If something sounds wrong, do you get it checked on? Yes, you do. I will maybe take it a step further. I mean, do you clean your gun? Do you make sure your gun's in good shape before you go out hunting or something? I mean, of course you do. I mean, with the body, it's totally the same way. It's just that things we decide to do or changes we decide to make now have impact for years and years down the road. And I mean, you can severely, for example, just heart attack and stroke, which are some of the main things we're all worried about, you can severely cut your chances of that down by taking action now and deciding what you're going to do about it. But I think those are the things that keep guys from coming in. And, hopefully that helps some, and then maybe it doesn't sound so scary.
No, I love the analogy of how do you treat your truck. I mean, we should be treating ourselves the way that we're treating our vehicles that we rely on every day.
We're a lot less replaceable, that's for sure.
Are there any other nuggets of knowledge that you could share with the guys that are listening today?
Again, in thinking here at Volvo, one of the things I run into a lot, and I would share, is that tired, just because you have been working really hard, and I get it, you are. But tired does not equal cardio. We always talk about cardio and getting your heart rate up to a certain level of predicted and keeping it there. I mean, the studies would suggest that at least 150 minutes a week is what you need. And honestly, even if you're totally whipped from working, that's probably not the same thing to benefit your heart and lungs the same way. So I would invite people to find a way to kind of get some cardio in there, and be able to measure that, so that they can reduce their risk, and they'll feel better, because it also helps your frontal lobes in your brain. So things like depression and anxiety are better. Speaking of that, outdoors is better. That's a little motto you can keep with you. But there's been some great studies where these PET scans see where the brains light up, and find out that people who spend 30 minutes in the outdoors have higher sense of well-being. Their brains function in these frontal areas. We were created by the Lord to be outside. And so, if you can spend some time outside, frequently, that's a very good thing. Speaking of the Lord, I mean, I would say this to anybody medically: we're not mechanics, no matter what we say about your truck. Don't ignore your spirit. Don't forget you've got one. What do you want in life? What's your meaning in life? What are you doing? How you feeling? I mean, things like depression and anxiety kind of cycle for everybody. And we can help with that. You may not need much help. You just may need to check things out, make sure they're okay, and fix it yourself. But kind of spend a little time thinking what your goals are, your purpose, intention, because you can make a lot of your life. I mean, we can't control everything, but you can make your life a lot of what you want it to be, and certainly cut down on some of the bad stuff. We all take some risk. We just decide what's worth taking.
That's great wisdom. And I mean, we just really, really appreciate the fact that you're here joining us today, and also just to dive into these really, really important pieces of health. So thank you so much. And I just want to remind everybody that Dr. Hanks is available Wednesday, Thursday, and Friday at the Family Health Center. And you know, the best part is most of the copays here are only $5. So that's incredible. You can't beat that. Dr. Hanks, if somebody hasn't used the health center before, what do they need to do to get started with you?
Yeah, I mean, you can make an appointment in person. The phone number, actually, the main number is the answering service for care here, the medical company, but they can make an appointment. They have a very cool, very convenient app you can use for your smartphone. There's a website, carehere.com. You can make your own appointments. That's one of the interesting things. We don't rush the appointments the way a lot of places do. We really do not. And so if you have an appointment for a certain time, you can expect it'll be reasonably on time. I used to have a doctor I had to wait 2+ hours for. They ain't like that here. And, you know, we can do telemedicine, we can do video. There's a lot of things we can help people with. So it's really just a matter of taking that step, and you can either do it on the phone or on the internet / app or in person. And, you know, we'll get records from a private physician if you need to, but we are a full family practice from age 2 to whenever. And that's really kind of how to see it. I mean, we can be a little bit of an urgent care sometimes, but pretty much what we're here for is a family practice to keep people healthy.
And yeah, so please take advantage of Dr. Hanks and the awesome services that you guys have at the Family Health Center.
Yeah.
And we want to thank you so much for your time today.
Yeah, this is great, powerful information. Prevention really is key. I know Kevin and I talk about that a lot. So we do hope that more people will come and get checked out. And for any questions on your wellness, nutrition, and fitness, feel free to reach out to us at tfoley@carehere.com or Kevin
at kevin.muniz@consultant.volvo.com. Thank you, everybody.